Good morning. Today I will be treating an intra-substance supraspinatus tear in a 35-year-old male. He has been suffering with shoulder pain for several years now. The pain is of grade 3 severity and is bothering him constantly. He is unable to elevate the arm against resistance. The supraspinatus muscle and tendon are part of the rotator cuff. The rotator cuff helps in elevation of the arm. An MRI scan shows an intra-substance tear of the supraspinatus, which comprises nearly 70% of the bulk of the tendon. He has also got some acromioclavicular joint arthritis. I will be injecting platelet-rich plasma and human recombinant collagen into the substance of the rotator cuff tendon under ultrasound guidance. I will also be injecting platelet-rich plasma into the acromioclavicular joint or the collarbone joint, and also will be dropping some platelet-rich plasma or PRP into the sac above the rotator cuff tendons, which is known as the subacromial bursa. The interesting feature of this case is the use of tendocollagen or human collagen. This human collagen has been genetically engineered to grow in the tobacco plant. The advantages of human collagen are that it forms a perfect triple helix. Experimental studies and clinical studies have shown good and faster healing with the use of human collagen. The other interesting point of the case today is that I will be using ultrasound guidance to place the needle precisely in the substance of the tendon. Ultrasound guidance is the ideal way to treat shoulder disorders in India. Many sports people are suffering from shoulder pain and they have got probably some impingement or a partial rotator cuff tear or intra-substance tear. And they can all be treated with this combination of PRP and tendocollagen. The same combination of PRP and tendocollagen can also be used to treat conditions around the elbow like tennis elbow and conditions around the heel. That is the tendon inflammation in the tendoachilles or the heel cord. Come, let's watch the procedure. These are the x-rays of the shoulder. This is the anteroposterior view of the right shoulder. It looks fairly normal. And this is the axial view of the shoulder. There is no evidence of arthritis of the shoulder. These are the views of the collarbone joint or the acromioclavicular joints of both sides. Here's the right and the left, and there is a hint of some narrowing in the right collarbone joint. So these are the precise indications for which platelet-rich plasma injection can be given. That is collarbone joint arthritis, partial rotator cuff tears, and intra-substance tears in the shoulder, glenohumeral joint arthritis, that is the arthritis of the main shoulder joint in early cases where there is no restriction of movement. I'm going to show you how the ultrasound works. This is the ultrasound machine. This is a probe. This is used routinely for musculoskeletal ultrasound. Its frequency is 12, and this is what we are going to use in today's case to scan the right shoulder. The right shoulder, this is the patient, and this is the right shoulder. We are going to be injecting the supraspinatus, subacromial bursa at first, then the supraspinatus tendon and the acromioclavicular joint. This is the head of the humerus, and this is the rotator cuff tendon, which is going to be inserted into the greater tuberosity. Here it is getting attached here. The degeneration is situated in this area where there is some fluid. There are some fluid-filled spaces in the substance of the tendon, and we'll be injecting it somewhere about, not too much. And you can see this is the subacromial bursa. This is the supraspinatus tendon. This is the deltoid, and this faint black space here between the deltoid muscle and the supraspinatus is the subacromial bursa. I'll be injecting that also. These slides show the properties of PRP or ACP and the collagen scaffold known as Vergenix STR.